Hi, my name is Julia Parker, and I'm going to be talking about blood flow through the heart and the physiology of the heart, along with a disease of the heart and the physiology of how that disease affects the heart. So, yeah, here we go. So, atria and what they do. There are two atria of the heart, and that is the left and the right atria. The left atrium receives blood from the lungs, and the right atrium receives blood from the body, from the vena cava. They receive blood when relaxed during diastolic period and contract to move blood into the ventricles during the systolic period. So, if you remember back in AMP1, we talked about how there's a pulmonary and a systemic circuit. So the right atrium receives blood actually from the systemic circuit, and the left atrium receives the blood from the pulmonary circuit, which is kind of contradicting since we kind of learned that the right side of the heart goes with the pulmonary circuit and the left side goes with the systemic circuit, but as to where they receive blood from, it's actually switched. Next, I want to talk about valves and what they do. Valves prevent the backflow of blood, so they kind of act like little doors to each chamber of the heart, so that blood cannot flow back into that specific portion of the heart. They do this by opening and closing. There are 4 valves that open and close to push blood through them to each part of the heart. The 4 valves are called the tricuspid, pulmonary, mitral, and aortic valve. They are one-way inlets of blood that allow blood in without letting it out, as I was saying. So we have the pulmonary valve and the tricuspid valve that go with the right side of the heart, and then we have the mitral and aortic valve that goes with the left side of the heart. And anyways, next we're going to be talking about ventricles and what they do. These are the last 2 chambers of the heart. During the systolic period, the ventricles will contract, which will pump blood through the body. During diastolic, the ventricles will relax and fill with blood again. There are 2 different ventricles, a left and right ventricle. The right ventricle receives deoxygenated blood from the right atrium, and the left ventricle receives oxygenated blood from the left atrium. So just as I was saying with the atrium, the left atrium, of course, will go with the left ventricle, and the right atrium will go with the right ventricle. And those valves are what stops the backflow of blood back into each chamber. So it's actually really interesting how that works, because the valves are kind of closing the doors to these 4 chambers so the blood doesn't flow back one way. Alright, so my disease I'm going to be talking about is heart failure or cardiac arrest. So usually with heart failure, the heart may not provide tissue with adequate blood metabolic needs. This will increase blood pressure in organs and result in organ congestion. It can come from disorders in systolic or diastolic function, or in many cases both. So the systolic and diastolic period, as we were saying, are blood pressure. So a lot of the times when one malfunctions, the other will malfunction. And that's why you don't see a lot of cases where only like systolic misfunctions or diastolic misfunctions, because usually they're very much so related to each other. Cardiac arrest stops blood from flowing to vital organs. This deprives your body of oxygen, and if left untreated, it will result in death. So one thing to remember is that your body needs oxygen, and that's what blood does. So cardiac arrest is kind of what happens when your blood can't get oxygen that it needs, because your heart isn't going to be able to pump those adequate amount of blood anymore. So signs and symptoms of cardiac arrest: there's chest pain or discomfort, heart palpitations, rapid or irregular heartbeat, unexplained wheezing, shortness of breath, fainting or near fainting, lightheadedness or dizziness. So a lot of these symptoms are kind of things that could even go with something as common as indigestion, because I get a lot of chest pain when I have indigestion that goes up into my throat. But I think in many cases with cardiac arrest, you should be able to tell. A lot of people pass out, and a lot of people will complain of being dizzy right before they pass out as well. And I think some of the symptoms, although they may be symptoms that go with a different like a different disease, it's really easy to tell when it's cardiac arrest. Treatment for cardiac arrest. CPR, usually immediate CPR, has to be administered for the person to live. Next, we have I'm gonna butcher this word, amoretic drugs. Then we have coronary agoplasty, coronary bypass surgery, or corrective heart surgery. So a lot of these have to happen even after the person becomes responsive. Usually surgery needs to happen so that this person can live a semi-normal life after this huge traumatic event. So anyways, that's my presentation, and here are my references. Thank you so much for listening.